compared to other parts of the country. Isn't that what we're talking about?
Well, Diane Mayhew is the co-founder of Merseyside-based Rights for Residents campaign, who we've spoken to many times before and during the pandemic. And she joins me now. Hi, Diane. What's your reaction, first of all, to this news?
Hi, Ian. Well, I think, whilst we all agree there needs to be a much fairer system, this clearly isn't it. And although it's an important and urgent issue, we feel, and RFR members feel, that what's more urgent is the visiting restrictions, because this actually is affecting people right now. And, to go back to the cap, what we're saying is that people are selling their homes and paying huge and increasing fees for their own incarceration. We've got one of our members, she pays £7,000 a month for her mum's nursing care. And unfortunately, 3 staff members have now tested positive and all visits have halted. So, the only person that has that unique shared history has been stopped from going in, and she's paying all that money to be, imprisoned, and it's so wrong. We're finding that, there's a growing reluctance of people in the community to place anybody in a care home because of this issue. I know from our own experience that whilst I know this is obviously the money side of it is very important for us when Jean was alive, all we could think about was just getting in to see her and being able to provide the emotional support that she so needed.
Yeah, this is your mum, Jean, who sadly passed away, that you're talking about there. And as you say, the cost of paying for care is high, or can be high. And for some families, it can wipe out nearly everything they've saved for, can't it? And as we've heard there, many even have to sell their homes to pay bills.
Yeah, definitely. And I think, some of our members have had to sell their homes to pay for the care and then had to move the person out of that care home because they can no longer fund it, via the local authority. It's not a fair system. And, as with everything, it's been disproportionate. And I think, we need to have a much, much fairer system. But as I say, Rights for Residents, the issue right now is that we're looking at facing yet another Christmas without being able to see those who live in care. We're already being told that they can't facilitate visits. So, for your listeners, spare a thought for all those living in nursing care right now who are going to spend yet another Christmas without seeing their loved ones. It's absolutely outrageous. And I think a lot of people aren't aware of Rights for Residents, and I hope that they will visit our website after this interview, because we are trying to get more prominence on the issue, and we're trying to get the government to legislate in law the legal right for every care home resident to be able to see at least one person that they have a unique history with. And also, to be fair, Ian, people who are living in care at the moment are totally being discriminated against because there are no restrictions whatsoever in society now. They've all been lifted. Every time I turn the telly on, you see gatherings where nobody's even wearing a mask. And unfortunately, that's not applied to those who live in care. And it's total inequality. There are no other mitigating measures that we can take now. We've all been doubly vaccinated. We've had the booster jabs. We follow infection control measures. We wear PPE, masks, take the tests, and we're still we're hearing that some people are only allowed a 30-minute visit once a week. And they're paying all this money for that, seriously.
I was going to say, Diane, is how problematic has the pandemic been for those in care homes, who work in care homes? Has that made it much more difficult for them?
I think it has, nobody's criticising the carers. They've done an amazing job and they've seen a hell of a lot. And at the height of the pandemic, it must have been so traumatic. But things have moved on now. We know a lot more about the virus and we have, infection control measures in place. And let's face it, the carers are part of community. So So they can go to all these gatherings, they can go to festivals, football matches, weddings, family celebrations, and they're going back into care homes and providing personal care. So all relatives want, and residents, is to be able to just go into the room of that person and be able to spend quality time with them, because they're already living on borrowed time. Everybody knows that most people living in care, the average lifespan is 18 months to 2 years. So many people have already lost their lives. And there is no point keeping somebody alive simply to exist. They have got the right to a family life, and this is against their human rights. It's not, can you imagine if it was your wife or daughter or son, and all of a sudden, unfortunately, illness doesn't discriminate. It can happen to anybody at any age, and they can be taken away, and they have no choice but to be put in nursing care. They might need 24-hour care, and then you're told that you can't see them again. We've already had 19 months of this now. No wonder people are giving up the will to live and saying they want to die.
So,
Go on, sorry.
No, sorry. No, you're okay. I was just going to say, because as I mentioned at the start there, we've been talking to you along the way, haven't we, over the last kind of 18 months while you've fought to gain access to residents in care. How has that kind of journey, if you like, changed along those 18 months?
Do you know what? Our campaign has been very successful, and for a lot of people, they are getting quality visits. That is not the issue. But the unfortunate issue is that many still aren't, and there's a postcode lottery across the UK of some who are getting really good visits, some who are not getting any, some who are just getting, average. We're still hearing of people that are having window visits and pod visits and screen visits, and I think the key here, Ian, is that when there's an outbreak in a care home, which inevitably there's going to be because there's no restrictions in community, and that's where transmission comes from, and staff are going to take it in. Nobody's criticising that either, but they lock down. And sometimes it can be a rolling lockdown, and that can be for up to sort of 42 days. So that person is isolated in their tiny room, not just away from their own family or person if they have been able to see them, but from everybody else in that care home too. And that's what is so wrong, because an essential visitor is allowed to go in. The guidance clearly states this during any circumstance, even when there's an outbreak, because they recognised that, the mental health and well-being is just as important as the physical health. And unfortunately, because it's at the discretion of care providers, some are choosing to follow it and some aren't. And those who aren't are being, they're suffering. We've got members who are literally undergoing therapy because of this issue. They can't sleep.
Yeah, it's difficult, difficult for everyone, but very difficult. And I know you've been working hard with the campaign, Diane. We're out of time, I'm afraid, Diane. But thanks very much indeed for giving us an update on how it's been going over the last 18 months or so. There we are.
Okay, thanks, Ian.
Thanks, Diane. That's Diane Mayhew, is the co-founder of Merseyside-based Rights for Residents. It's mid-morning here on BBC